Welcome to the Rehab Roundup. I am your host, Dr. Hassan, independent practice owner, board certified physiatrist and independent practice owner, helping physiatrists start and grow their own practice so that they can achieve financial independence and live without limits. Back to those of you who tuned in past couple days, and for those of you who are in for the first time, welcome. So over the past couple days, we have talked about billing company, retirement planning, kind of all business related concepts around being a physiatrist who practices in an inpatient setting. Today, though, I want to talk about the actual practice and how that matters. As physiatrists, we are the post-acute specialist. We can practice in multiple settings, be that the acute care hospital, that's where everything starts, it's the hub, acute inpatient rehab, you have skilled nursing or subacute rehab, you have the LTACs, and then you have home health that I don't necessarily think we've utilized as much as we can and should, and then you also have outpatient. I myself don't do a whole lot of outpatient. That is a space that we can in and generate revenue. So it's important to know where you are and what the practice setting is. That's important. So, for example, for a Medicare patient versus a commercial patient. So, patients who are in observation status, for Medicare patients, you can only bill one code. Whereas commercial patients, they actually have an observation code that you could potentially bill. And that's important because you want to take a look and see which code is going to reimburse you at the higher rate. I'm actually going to take a one-on-one coaching class with Dr. Charlotte because she's great in terms of really laying out the codes, the different things that you have to do to make sure that you meet the audits to bill at that particular code. So she's going to be a great resource for you in the future if you want to learn a little more about coding. And all the practice setting matters because you're going to build different codes in the acute rehab setting versus the subacute rehab setting. And also the reimbursement is a little different depending on what setting you're in. So typically, historically, from a Medicare standpoint, in the acute rehab setting, they bill a little higher than they do in the skilled nursing setting. It's not a tremendous amount, maybe $5 to $10, but everything counts. Really though, in the acute care hospital, acute inpatient rehab, and LTAC, they're all classified as acute care hospital. So really those codes are going to be the same, which is important. And then we also talked about the home health space, or basically when the patients are quote unquote home. That could be assisted living, independent living, or in their own kind of setting. It's a different set of codes that you would utilize to kind of bill for those services. So knowing where you are, what your practice setting is important because it potentially impact your billing. You always want to know where you are so that, again, when you're seeing patients, you want to maximize the amount of revenue that you generate because you don't want to leave anything on the table. We're out there taking care of patients, helping them get better, getting them back to life. And in the process, we need to make sure that we're doing right by ourselves and our business because we are the business. So takeaway point is know where you are, know what the practice setting is. A couple different settings that can be acute care hospital, acute inpatient rehab, skilled nursing, LTAC, home health, outpatient. Thank you for joining in to the Rehab Roundup. I'm Dr. Hassan, board certified physiatrist, independent practice owner, helping physiatrists start and grow their own profitable practices so that they can achieve financial independence and live without limits. Go to Facebook, follow me at Hassan Rehab, DRHASSANREHAB. And next week, we're going to talk about something big that I got for you. Got a resource for physiatrists to kind of about business setup, other different concepts to kind of help you maximize your earning potential. So thank you for joining in, and see you tomorrow.